Hello, good morning. Hi, everyone. Great to see you here on a lovely Wednesday, sunny morning. Doesn't feel like October today, which is great. Thank you so much for coming. This is, I know, a very valuable session for so many, and we're actually very pleased and grateful to have John Roser here, who is recording it for our local cable, and will run this programming for the month or more as well for the open enrollment. Let me just also, I can't pass up an opportunity just to advertise a little bit about other things that we might be doing here or around town. So next Wednesday is another cafe talk as well. The speaker is Paul Lawton. He's a local attorney and historian. He's contributed to some texts, one in particular by the man whose name I'm going to now forget when I try to say it. He's a famous author, Polio, and he did the molasses flood in the North End and a book on a World War II battle, and I had heard him speak before, but he is talking about an untold story of a German secret plan during the final days of World War II, and apparently there's so little we know even about some of the first and last battles around World War II that happened off of our coast. So he has researched a lot of these. This paragraph I just love, and it just sounds like a drama on television. The surrender of several German U-boats at Portsmouth, New Hampshire was followed by the mysterious death of one of their commanding officers at the Charles Street Jail in Boston, and the secret work by his brother, a rocket scientist under Dr. Werner von Braun, who came to the U.S. and helped in the development of America's ballistic missile and space programs. I mean, that's good stuff. It's like Agatha Christie. So anyway, it will be great, and I hope maybe you will spread the word, come again, and enjoy some of the other. We have a flyer that lists all of the upcoming talks as well. And then one last thing, just as you know, there's been a lot of, hopefully enough, and there will be more press, so hopefully you don't get sick of hearing about it. And in addition, our health fair tomorrow, hopefully you are coming, and there'll be more information like this there tomorrow. But the survey that we have been developing with UMass's gerontology department and their research team, it's going to target and help us to find out what the community really does want and need, the services and programs that they've been happy with, what we can continue to do, what they feel we haven't been doing, the needs we haven't been meeting, and also just improving the opportunities for you to get the information and find the activities and the programs and the resources that you need moving into the next 10, 20, 30 years as well. So hopefully you may not get the survey. It's 2,000 random sampling, but if we talk it up, you may know 5 people who get the survey. So spread the word, pass it around, encourage people, of course, if they do get the survey, just to complete it and get it back to us, because it will be very valuable data and information for the town and moving forward for us as well. I think that's all I wanted to say, but again, thank you so much for coming, and let me introduce Peggy McDonough. She is the Regional SHINE Director. So SHINE, we use the term all the time. Everyone knows Norman, of course, or should. Norman Tetro, who is our volunteer for insurance information. SHINE stands for Serving the Health Information Needs of Elders, or did they change it to everyone? They changed it to everyone. Why not? It should be everyone. So thank you very much, Peggy, for coming. I'll let her take over. So thank you. This is so much fun.
Good morning. I'm going to try to make this as simple, which is kind of a joke because I'm not sure that any of Medicare is really simple, but I'm going to try to make it as easy to understand as possible. And you know you have a fantastic SHINE counselor here. He's just wonderful. So you can always talk with Norm individually. I agree. He makes my job a lot easier. Open enrollment starts today, October 15th, and it continues until December 7th. And this is the time of year when Medicare beneficiaries can make a decision about how they get their Medicare. The choice that you make by December 7th takes effect on January 1st. And then from January 1st until next year, you're pretty much stuck with that decision. So it is important to every year look at how you're getting your Medicare. During open enrollment, somebody who's in a Medicare Advantage plan, and that would be a Medicare HMO or a Medicare PPO, can change plans. They can go to another Medicare Advantage plan. They can go back to original Medicare and pick up a standalone Part D plan. If someone's in original Medicare, they can switch to a Medicare Advantage, Medicare Hmo, Medicare PPO. They can change their Part D plan. And if you're in original Medicare with a standalone Part D plan, it's a very good idea each year to look at that Part D coverage to make sure for the following year you'll be in the best plan. I'm just going to cover a little bit about how Medicare works. And I want to tell you that in your packet, the cover sheet of your packet really goes through this in, I think, pretty easy to understand language. But I'm going to do this kind of quickly. Original Medicare includes Part A, hospital insurance, and Part B, medical insurance. And Part A, hospital insurance, covers if you go into the hospital, and it covers in a skilled nursing facility, a SNF. Part C is the Medicare Advantage, HMOs, PPOs, special needs plans. Part B is the medical piece, and that covers doctors and other medical. And I have a note up here because this is just so important about SNFs, skilled nursing facilities. In order for Medicare, and this would be someone on original Medicare, in order for Medicare to cover in a SNF, the individual, the beneficiary, has to have a 3 overnight stay in a hospital as an inpatient. It can't be under observation status. It has to be a 3 overnight stay in a hospital as an inpatient, and then they have to go into a SNF, a skilled nursing facility, within 30 days of discharge of that hospital, and then they have to require skilled care on a daily basis. If all that comes to be, then Medicare will cover in full in the SNF from day 1 through 20. Day 21 through 100, there'll be a copay. But we've seen a lot of problems in the last few years with Medicare beneficiaries going into the emergency room and then being admitted, going upstairs to a bed and spending a few days, and then being discharged, and upon discharge being told that they were never admitted as an inpatient, they were there under observation. And if that's the case, Medicare won't cover them at all in a SNF. So it's a major problem. And there are advocates working on this problem, including the Medicare Advocacy project that provides free legal services to Medicare beneficiaries. They're working on this to get that 3-day period eliminated because it is such a problem for people. If someone is in a Medicare Advantage plan, a Medicare HMO or PPO, they usually don't require that 3-day overnight stay in a hospital for coverage in a SNF. Under original Medicare, there are pluses and minuses of having original Medicare versus a Medicare Advantage plan. If you're in original Medicare, you have freedom of choice. You can go to any hospital, any doctor, anywhere in the country who accepts Medicare. You don't need a referral, and you don't have office copays. That's the good news. The bad news is that there are big gaps in original Medicare. And the big gap in Part A is a hospital deductible. And in your packet, there's a green sheet, and I'll refer you to this green sheet. It's about the 3rd page in. And on the front side of the sheet, it talks about Part A benefits and gaps. And you'll see at the top of the column, at the top of the sheet, it talks about inpatient hospital, what the beneficiary pays and what Medicare pays. And the big gap in Part A for 2015 is the hospital deductible of $1,260. So if I have original Medicare and no other insurance, and I go into the hospital, I'm responsible for that deductible, $1,260, and it's per 60-day benefit period. That's not an annual deductible. So if I went into the hospital, I'd have to pay that. If I went home and I was home for 65 days and I went back in again, I'd have to pay it again. So it's per 60-day benefit period. It's not annual. That's the big gap in Part A. Part A, I mentioned, if a beneficiary has a 3 overnight stay and they go into as an inpatient, they go into a SNF within 30 days of discharge, Medicare will cover in full from day 1 through 20, day 21 through 100 in 2015. They have a copay of $157.50 per day in the skilled nursing facility. But the big gap in Part A is that hospital deductible. Most people who choose to have original Medicare, maybe because they want freedom of choice, live in Scituate, maybe you want to be able to went to Boston or choose any doctor anywhere. And original Medicare provides that option for people. But if someone is on original Medicare, they really need to purchase additional insurance to cover those gaps, like the hospital deductible. And that's called Medigap Insurance. And they also need to purchase a Part D drug plan. So now we're talking about the Part B monthly premium that gets deducted from Social Security, a monthly premium for Medigap, and a monthly premium for Part D. So the premium cost can be high. The next, and by the way, on your green sheet on the back of that are Part B benefits and gaps. And the big gap in Part B, if I have Medicare A and B only, and I go into the hospital, I have that Part A deductible to pay, and then Medicare covers Part B coverage 80%. I'd be responsible for the other 20%. It's the Part B that covers doctors that I see, whether I see them in the hospital or outside the hospital. So the big gap in B is that if I were in the hospital, I have the Part A deductible, and I'd be responsible for 20% of all the doctors that I see, 20% of their bills. That's the big gaps in A and B. So if I want original Medicare, I want to purchase insurance that will cover those gaps, and it's called Medigap Insurance, also referred to as Medicare Supplement Insurance, but Medigap Insurance. And you have this sheet in your packet. It's the next sheet. It's white, has blue heading on the top. And this is the list of Medigap plans available in Massachusetts. On your sheet, I have in red the 2015 prices. We still don't have it for all the plans at this time of year. They're still negotiating these. But all the companies offer two types of plan, Core and Supplement 1. Core is that middle column, and Supplement 1 is all the way over on the right. And if any of you are familiar with Blue Cross Blue Shield MedX Bronze, that's a Supplement 1 plan. They call their Supplement 1 MedX Bronze. So I always use that because I think people then have a grasp of what I'm talking about when I say Supplement 1. If a Medicare beneficiary purchases a Supplement 1 Medigap plan, it's going to cover all the gaps in Medicare. It covers the hospital deductible, covers the 20% for doctors, covers the Part B annual deductible, which is $147 this year, same as last year. Covers the additional days in the SNF. So if I go into the hospital and I'm there 3 overnights as an inpatient, and then I go into a SNF, Medicare covers in full from day 1 through 20, and then I have a copay from day 21 through 100. The Supplement 1 will cover that copay for 100 days. That's the maximum. Covers foreign travel. Some of the core plans now also cover that, but covers all the gaps in Medicare's health care piece. You see in yellow I say does not provide prescription coverage. This only covers the gaps in the health care piece. And for 2015, so far it looks like the lowest cost Medigap is going to be with Blue Cross Blue Shield. Last year, Blue Cross Blue Shield's Medigap was the cheapest. When people would call me and say, what's the best Medigap, I'd say the cheapest. And the reason I said that is they all do exactly the same thing. If you purchase a Supplement 1 plan, any one of these Supplement 1 plans provides exactly the same coverage of the gaps in Medicare. There's no difference in the highest cost plan from the lowest cost plan in terms of the gap, covering the gaps in Medicare's healthcare piece. Now, some of them might have an add-on like gym membership or discount or things like that, but that's not part of Medicare. So in terms of covering the gaps in Medicare, they all do exactly the same thing. All Supplement 1 plans do, all core plans do. So when people say, what's the best one? I say the cheapest. And if this year, whatever the cheapest is, if it turns out to be Blue Cross, I'd answer the same way, the cheapest. If it's another company, I'll still say the cheapest. Core plans, you notice, are cheaper than the Supplement 1. And they're cheaper, they cost less because they don't quite cover everything that a Supplement 1 plan covers. Core doesn't cover the hospital deductible. So if I have Medicare A and B and a core plan, and I go into the hospital, I will be responsible for that hospital deductible. Core will pay the 20% for doctors once I've met the annual 147 Part B deductible. When a beneficiary sees a doctor, the doctor doesn't know, doctor's office doesn't know whether you have core or Supplement 1, doesn't matter to them. And all doctors take these plans. You don't have to call your doctor's office to say, do you take Blue Cross Medigap? Do you take Fallon Medigap? Do you take Harvard Pilgrim Medigap? They all take it. They don't sign contracts. All the plan is doing is paying your portion of the cost. It would be like if I paid his hospital deductible for him. That's exactly what these plans are doing. They're paying your portion of the cost. Now, what gets a tad confusing here is that some of these companies sell more than one product. Blue Cross, Fallon, Harvard Pilgrim, Tufts also sell Medicare Advantage plans. So if you called your doctor's office and said, do you take Fallon? They might say, no, we don't take that. Because they might not take Fallon's HMO. But everybody takes a Medigap, so you never have to worry about that. But keep in mind the prices here for the monthly premium, because on top of that, you have to buy a Part D drug plan. But if you have a Supplement 1 plan, again, you can go anywhere you want, no referrals, and no office copays, no out-of-pocket cost. As long as it's a service that Medicare covers, this is going to kick in. If you decide to get a facelift, Medicare won't cover it and this won't kick in. But as long as it's a service Medicare covers, this will kick in. So you know that you have that monthly premium, but you don't have additional copay costs. Now, Medicare Advantage plan, and this is Medicare HMOs, PPOs, and special needs plans. This is Medicare's managed care option. So when people become eligible for Medicare, they can have original Medicare or they can have a managed care plan under Medicare. And these plans sign contracts with CMS, the Centers for Medicare and Medicaid Services, to provide you everything you're entitled to under Medicare. If one joins a Medicare HMO, that's the most restrictive. They have to stay in network. So if I join an HMO, I have to see the doctors within that network, or one of those doctors has to give me a referral if I need to see somebody out of network. But if I'm in an HMO and I decide to go out of network to see somebody, the HMO won't pay and Medicare won't pay, because I've agreed to get my Medicare services through the HMO. This is not supplemental insurance. This is not. This is Medicare. You get your Medicare either under original Medicare or through one of these plans. A PPO allows someone to go outside of network, usually at higher copay costs. So a PPO would give a little bit of freedom. It's important to remember that these plans outside, if you travel, only are required to provide urgent or emergency care, not routine care out of area. If you have a Medigap plan, you can get routine care out of area, as long as it's routine care that Medicare covers. Special needs plans, one of the special needs plans is something called a SCO, a senior care options. And in order to be eligible for this, a person has to be 65 years of age or over, and they have to have Mass Health standard. They can have Medicare as well, but they have to have Mass Health standard. But if they're eligible for this, it provides lots and lots of coverage. They don't pay a copay for it. They don't pay copays for their drugs. They get comprehensive dental. It's wonderful coverage. To have Mass Health standard, usually a senior has to have very low income, and I will touch on that. If your doctor or provider says that he or she is no longer staying in the Medicare Advantage plan, and I know I've had probably about 50 calls from people whose providers are affiliated with Milton Hospital, and they're pulling out of Tufts. So their option, if they want to stay with their doctor, is to find another Medicare Advantage plan that the doctor accepts, or go back to original Medicaid, because we know they'll all take that. And they have to make that decision so that they'll have the new coverage in place for January 1st, even though, as far as Milton Hospital goes, folks have a stay with the coverage they have until the end of the year. But they have to make the choice by December 7th, so they'll have something in place for January 1st. If anybody who's in a Medicare Advantage plan decides to go back to original Medicare, they have to choose a Part D drug plan as well. If someone in one of these plans that the providers is pulling out of wants to stay in the plan, they just have to find a new provider. But that's another option, of course. If your doctor says, I'm pulling out of this plan, you can stay with the plan, but you would have to change doctors. Okay, let me talk a little bit about the Affordable Care Act. In your packet, the second sheet in is a list of preventive benefits. And I'm not going to go through those now, but under the Affordable Care Act, the preventive benefits for Medicare beneficiaries have greatly improved. I've been doing this for 21 years, and when I started years ago, there was almost no preventive benefit services. So I've seen a humongous improvement in preventive benefits for Medicare beneficiaries, and I think it's great. And the discounts in the donut hole. You know about the donut hole? No? The donut hole in 2015 is when, well, under Part D, when Part D started, Part D provided coverage for a period of time to Medicare beneficiaries, and then they hit the donut hole, and then they had to buy everything out of pocket. Under the Affordable Care Act, people are getting help now through the donut hole. But for 2015, this is what Part D plans look like. What? In 2015, the plans can charge a $320 deductible. They don't have to charge that. Many of the Medicare Advantage plans don't charge this deductible, or they charge less. And someone has coverage, the beneficiary, the member pays about 25% of the cost of their drugs, and the plan pays about 75% until the retail cost hits $2,960. And the retail cost includes what you, the member, pay and what the plan pays. It's not everything out of your pocket. So for instance, if I were in a plan and I had very expensive medication, I'm apt to hit that retail cost pretty quickly. If I take medication that costs $1,000 a month, I'm going to hit retail cost pretty quickly, and then I'm in the donut hole. And in the bad old days, I'd have to pay in full once I hit the donut hole. But now, because of the Affordable Care Act, for 2015, beneficiaries get a 55% discount on brand drugs and a 35% discount on generics while they're in the donut hole. And the real good news, and I want you to stay calm about this, is that by the year 2020, there won't be a donut hole at all. So this is good news. Now there are programs that can help with some of the cost of health care for Medicare beneficiaries. And most of them look at income and assets. And one program called Extra Help can help with premium, the Part D premium, co-pays, the deductible. To be eligible, an individual's gross monthly income, and when I say gross, that includes the $104.90 that gets deducted from your Social Security check before you get it, which is going to stay the same this year, by the way. That $104 is not going up. So when you look at gross, you have to look at the check that you get and add that $104.90 back in, because your Social Security check is your net amount. So gross for an individual, gross monthly income of $1,479, and cash assets, $13,440. Not the home one lives in, not the car they drive. For a couple, $1,987 a month income, gross, and assets, $26,860. If somebody meets this, they can get extra help with their Part D, whether they're in a standalone Part D or in a Part D plan that's connected with an HMO or PPO. Did you have a question?
Say your income is higher than that, but your assets are lower than that. Do they combine the two, or one, okay, if you got this, then Doesn't matter what you have.
I love that kind of creative thinking. But he said, if your income is higher but your assets are lower, can they sort of mesh them together and make you come out so you meet this? No, they don't. You have to meet the income and assets to get on it. And if you're in a Medicare HMO or Medicare PPO, you are getting the Part D within that plan. Part of the monthly premium that you're paying goes toward that Part D coverage. So if you are eligible for extra help and get on the extra help program, it's going to lower your monthly premium within the HMO or PPO. And by the way, if you're in a Medicare HMO or Medicare PPO, and you hear that your friend has a great drug plan, Part D standalone drug plan that seems better than what you have, and you decide to join it, they'll drop you from the HMO or PPO. If you want Medicare drug coverage and you're in an HMO or PPO, you have to get it within that HMO or PPO. Now, someone who has outside drug coverage, like a veteran, someone who goes to the VA to get their health care coverage, could join a Medicare HMO that doesn't provide drug coverage, and that's perfectly okay. But unless you have coverage outside other than Part D, you have to get your Part D within the HMO or PPO. Prescription Advantage. I hope people here have heard about Prescription Advantage before. I'm sure Norman talks it up whenever he can. But Prescription Advantage is a state program, Massachusetts program, that acts as secondary payer to a Part D drug plan, whether the Part D drug plan is a standalone plan or within the HMO or PPO. To be eligible to join this for free, an individual's gross monthly income can't be higher than $2,918 and a couple $3,933. This income level can join for free, and they don't look at assets. They look at the income assets generate, but they don't look at assets in qualifying somebody. And if I'm in Prescription Advantage and I hit the donut hole, that's when this will kick in. And I'll tell you a story. Last year we had a gal come in to see us, and she was retiring, and she took one of her medications, cost $8,000 a month. And she was very worried about what was going to happen when she got on Part D. We found her a Part D drug plan. We got her enrolled in Prescription Advantage. She was able to enroll for free. And the income category determines how much a copay coverage someone's going to have in Prescription Advantage. And the very first time, once she was on Medicaid with her Part D plan, that she filled that drug, she had a 33% copay with the drug plan. It was over $900 and something that she had to pay out of pocket for her copay. But she hit the donut hole immediately. So she also had an $18 copay to Prescription Advantage. Every month thereafter, she paid $18 for an $8,000 drug, and Prescription Advantage made up the difference. And it didn't cost her anything to join. So if you can join this plan for free, you absolutely should join. There's no reason not to join.
And how can you join it? What to do?
She asked, how can you join it? Do I have the answer for you? I have some applications here with me today, so I'll give you an application. Higher income folks, 2919 to 4863 for an individual, 3934 to 6554 for a couple, have to pay a $200 annual enrollment fee, and they don't get any help from Prescription Advantage until, as a member, they spend $3,450 out of pocket. So it may not make sense. If someone called me or Norman this late in the year and said, I'm in the donut hole and they're in that income category, it may not make sense for them to join it now, but it would for January 1st. So that's a different ball game, and those are the folks that we would do some calculating with to see. But if you can join it for free, you absolutely should join. Because there's one more thing that Prescription Advantage does. If I'm in a drug plan, I choose a drug plan, I do all my homework, I work with the Shine counselor, I get a new drug plan for January 1st, and a few months later, the doctor gives me a new medication that's expensive and it's not covered under the plan's formulary. I'm stuck for the year with that plan, unless I'm a member of Prescription Advantage. If I'm a member of Prescription Advantage, I get to make one switch throughout the year, so I could change my drug plan. It's another benefit. It's another reason why we say if you can join for free, you absolutely should. If I never joined Part D because I didn't take medication and I said I'm not paying another premium for something I don't need, and suddenly open enrollment comes and goes, and on January 2nd I have a heart attack and now I need expensive medication, I can join Prescription Advantage. It will open the door to get me into a Part D plan. It will not eliminate the penalty. And by the way, someone who was 65 when Part D started in 2006, it started January 1st, 2006, but the penalty clocked for late enrollment, you know, there is a late enrollment for it. If people never signed up and didn't have other coverage, like veterans coverage or employer retiree coverage, and want to sign up, there's a penalty of 1% per month for all the months they could have been in but weren't. So if someone were 65 on January 1st, 2006, never joined, this year they've decided to join because now they take medication, they'll have a 103% penalty. And it's lifetime added on to their monthly premium. Mass health programs. Most benefit programs look at income and assets. And the way they work, the lower the income and assets, the higher the benefit is. So mass health for a single person can be eligible if their gross monthly income, I have to add in that $104.90 again, is no more than $993 and their cash assets are no more than $2,000. That's very low income. For a couple, $1,331 a month, cash assets no more than $3,000. Mass Health Frail Elder Waiver. Now, by the way, if someone gets on Mass Health Standard and they have Medicare, they have about the best coverage they can have because Mass Health's going to kick in and pay hospital deductible and co-insurance and help them with their drug coverage. It's wonderful, wonderful coverage. But there's another program called Mass Health Frail Elder Waiver. It has other names too. And this program will make someone eligible for Mass Health if they meet the requirements, the eligibility requirements. And one requirement is that they meet the income, and this is a higher monthly income, gross income, $2,163 a month, cash assets no more than $2,000. They have to be receiving a home care service, and in this area that would be South Shore Elder Services, would be the home care agency. And they have to meet the clinical eligibility, and that is, screening is done by the nursing staff at South Shore Elder Services. And if they meet all of those ingredients, eligibility requirements, they can get on Frail Elder, and it provides Mass Health Standard. And you see, the income's a lot higher. Now, this program works wonderfully, and we see this a lot. It works wonderfully with couples. So for instance, I'm age 70, and I have early onset Alzheimer's. And my husband is my primary caregiver. And he's getting worn out, and that's what we see all the time, that oftentimes people wind up going into nursing homes because their caregiver just can't do it anymore. They get sick themselves. If my income alone is no more than $2,163, and the cash assets in my name alone are no more than $2,000, Mass Health will waive his income and assets. So for instance, I'm 70, I have Alzheimer's, my income is less than that, but we have $50,000 in a savings account. My name comes off that account. I only have $2,000 in my name, and the rest stays in his name, and Mass Health will waive whatever his income is and his assets, and I will get on Mass Health Standard. And it will provide me lots more services, if I can get that, including Mass Health will pay for a day program. So if my husband is getting stressed because he never gets to sleep because I'm up all night, or he doesn't get to see friends, or Mass Health would pay for a day program and pay for the transportation 5 days a week. So he would get a break and be able to do some things, take a nap during the day or whatever. So this program waives the income and assets of the spouse. But one more thing I want to mention about Mass Health in the community. If I wasn't married and I had a very low income below this $993, but I had cash assets of $10,000 instead of $2,000. If I'm applying for Mass Health in the community, not long-term care, in the community, I can transfer assets out of my name. So I transfer $8,000, because I have 10, I can only have 2, I transfer $8,000 to Norm. I list that on the application. I'm eligible for Mass Health Standard. That transferring the assets doesn't disqualify me, But if 6 months later, on June 1st, I say to Medicaid, Mass Health, I want you to cover me in a nursing home starting June 1st, they would disqualify me then. That's when the assets come back into play. For the length of time that $8,000 would have covered me. And if I'm applying for a nursing home that costs $8,000 and I say I want you to cover me June 1st, this is a very simplified layperson's explanation. They would say, no, we're going to disqualify you for June, but we'll start on July 1. So, but it is okay to transfer assets and qualify to be in the community, not for long-term care Medicaid. That's when they come back into play. So if you transfer anything to your kids, don't let them spend it. It's just wonderful coverage. There's programs under Mass Health called buy-in, and what these programs will do is pay the Part B premium for someone. And to be eligible, individual's gross monthly income can't be higher than $1,333, and a couple $1,790, and individual cash assets $7,160, couple $10,750. But again, if I meet this income and asset, Mass Health will pay my Part B premium, so it will go back into my Social Security check, and I'll have more money coming in. And then if I get this program, it also makes me automatically eligible to get help with my Part D drug costs, the premium, co-pays, deductible, all of that. There's another program called the Health Safety Net. And actually, before I get into that, I wanted to bring you to another section of your packet. You thought this was going to be easy. I want to bring you to this section. It has a green heading at the top. And these particular pages are numbered. So you have page 1 on the bottom right-hand corner. There's 10 pages here. Don't worry, I'm not going to make you read every one of them. So we're all on page 1. This is HMO plans, and the first plan listed here is Blue Cross Medicare Hmo Blue Value RX. Remember I said that many of these companies sell more than one product. So this plan has an you see in yellow, out-of-pocket, OOP, out-of-pocket annual maximum of $3,400. That means if I'm in this plan, and maybe during the year I have a lot of hospitalizations or I have a lot of costs, and I've spent $3,400 out of pocket, not including drugs, just health care, then at whatever point I reach that in the year, for the rest of the year I won't have any out-of-pocket costs. But in this plan, the monthly premium is $27 a month for people living in Bristol, Norfolk, and Plymouth, and Suffolk County. So that's pretty cheap, $27 a month. Remember, because you saw what the cheapest Medigap Supplement 1 is. It's over $175, $176. This plan can charge the $320 deductible, but it doesn't charge it on tier 1 and 2 drugs. It only imposes that deductible on tier 3 to 5 drugs. So if I join this plan and I take 1 and 2 generics, I won't have that deductible to face. For a 30-day supply of drugs, tier 1 is 4, tier 2 is 8 copay, tier 3 is 45, tier 4 is 95, tier 5 is 25%. To see a primary care doctor in this, I'll pay $20. To see a specialist, I'll pay $40. Still not bad. For a $27 a month premium, not bad. But here's where the cost comes in. If I go into the hospital in this program, in this plan, from day 1 through 7, I'll have a $250 per day copay. That's where the cost comes in. I have a low monthly premium, but I have a high out-of-pocket cost if I go inpatient. Look down at the next plan on this page. This plan is $193 a month, so now the premium has gone up quite a bit, so you can expect that somewhere the costs are going to go down. They charge a $200 deductible on tier 3 to 5, no deductible on tier 1 to 2. Co-pays for drugs, 2, 6, 45, 95, 28. Primary care doctor, 15. Specialist, 35. But for in inpatient care from day 1 through 5, it's $150 a day as opposed to $250 a day in the more expensive plan. Let me ask you to go, we're only going to do a few of these, I promise. Let me ask you to go to page 7. This is This is a Tufts plan. Tufts has several HMO plans. So are you all on page 7? And the number's on the bottom right-hand corner. And look at the plan on the bottom for Norfolk and Plymouth and Bristol County. This HMO, it's called HMO Prime RX Plus, costs $188.20 per month. Pretty expensive. No deductible at all for the drugs in this plan. Co-pays for drugs, $2, $5, $30, $80, and 33%. To see a primary care doctor, $10. To see a specialist, $15. If someone goes in the hospital on this plan, they pay $200 per day with a $400 annual maximum. So if I'm in the hospital 2 days and go home, and a month later I go back in and I'm in 3 days, I'm only going to pay $400. Once I hit that $400, I'm not going to pay anything more. So it's a much higher monthly premium and the inpatient costs. The costs are less. Turn now to page, I'm going to have you go back to page 6. You with me? It's bad enough this stuff is confusing, and then I have you switching around pages. And on the bottom of this sheet, their plan HMO Saver RX, no monthly premium. No monthly premium. And it includes drug coverage for no monthly premium. That's incredible. They impose the $200 deductible only on level 3 to 5 drugs. Co-pays for drugs 6, 12, 45, 95, and 28%. $20 to see a primary care, $40 to see a specialist. Still not bad. There's no monthly premium. You go in the hospital in this plan, however, from day 1 through 5, you pay $325 a day copay. So that's where the cost comes in. But have I got good news for you? There's a program under Mass Health called the Health Safety Net. And most Mass Health programs for people 65 and over look at assets. They don't look at assets for people under 65, but 65 and over, they look at assets. And this program allows a little higher income. For an individual can have an income of $1,945, and a couple $2,622 gross. Again, it's always gross. If someone is in this income category, as an individual or a couple, the Mass Health Safety Net will kick in. We call it full health safety net. So if I were in this expensive Tufts plan, that zero premium Tufts plan, and I'm eligible for this, this will pay my hospital co-pays for me. That's quite a deal. Remember when I talked about Medigap? That Medigap, I'll go back to that sheet. I can find it. Oops. That core plans, these plans, cheaper plans, don't cover the hospital deductible. If I'm eligible for the Mass Health Safety Net, that'll cover the hospital deductible. So if I am in a Supplement 1 plan, and I'm finding it harder and harder to pay my monthly premium, things are getting so costly. If I'm eligible for the Health Safety Net, I could go down to core. And the Health Safety Net would pay the hospital deductible for me. That's the big gap that core doesn't cover. I can still see the same doctors, nothing else changes. But this would cover the hospital deductible for me, and it doesn't look at assets. So this is a great, great program. We tell people about this program all the time.
Can I ask you a question?
Sure.
I have Medicare and Medicare, and I am 84. Can I take other insurance with Medicare?
Okay. Her question is, she has Medicare and Mass Health, can she pick other insurance? You can certainly pick other Part D plans. You can change your Part D plan, but Medicare and Mass Health is the best insurance you can have, really. So there isn't anything else. You mean to get off Medicare? No. Medicare and Mass Health standard, it doesn't get any better. Yeah, it's really great coverage. There is a fairly new, it's about a year old now, program in Massachusetts called OneCare. And this is a program for people between the ages of 21 and 64 who have both Medicare and Mass Health. And it's a managed care plan for these folks. They pay no monthly premium for it. They pay no co-pays for their medication. They get comprehensive dental. It's very similar to that SCO, that Senior Care Options plan I mentioned for people over 65. The difference is that people under 65 can have a little higher income and they don't look at assets of people under 65. And you know there are two ways people get Medicare. They age into Medicare at age 65, or if they're on SSDI, Social Security Disability Insurance, for 24 months, they automatically get Medicare on month 25. And in the last several years, I've seen a great increase in the calls that we get from Medicare beneficiaries who are under age 65 and on SSDI. So this is a great program, provides lots of service, and we like to tell people about it. And there is assistance available. You don't have these numbers in your packet, and if you want to write them down, I'll leave them up here a little bit. Shine is on that, our number is on that front page, 1-800-243-4636, on the top of the front page. If you press 3 and you live in a town that my program covers, it's going to come into my office. Prescription Advantage is the same 800 number. You press 2 when you hear the menu, and that will bring you into Prescription Advantage. I have some Prescription Advantage applications with me today, but you can also enroll online. You can call Prescription Advantage and you say, I want to enroll online, and they'll take your information online, not online, over the phone. I meant to say over the phone. You can do it online too, but you can do it over the phone. And they'll tell you what documentation you need to provide to them to get your application through. The Massachusetts College of Pharmacy Health Sciences. They used to be called the Mass Medline. It was a lot easier when that was their name instead of what it is now. But this is a program staffed by pharmacy students. And if you had a question, if you were on an expensive brand drug, for instance, and you wondered, is there a generic available, or you just had questions, you can call them and they can answer that. We do a lot, Norm and myself and the other Shine counselors, with finding drug plans for you, and we've gotten over the years familiar with a lot of this, but we're not pharmacists. And if you had a specific question, this is a great program to call. It's a free service. And Medicare, 1-800-Medicare. When I tell people, Medicare says, well, they're 24/7. Shine is not. We're Monday through Friday. And in my office, oftentimes this time of year, you're going to get voicemail. You leave your name and phone number, and I get back to you. But I'm out doing these things, so it might take me a day or two, but we will get back to you. And what I say, if you call Medicare at this time of year, get into a comfortable chair with a cup of tea or a good stiff drink and a book. It's probably going to be on hold for a while. And the bottom program is called the Medicare Advocacy Project. They provide free legal services, free legal representation to Medicare beneficiaries. So if you were disputing coverage that you thought Medicare should have covered and didn't, this is a program that can help with that. I think that is my last slide. I'll put those back up if you want to get numbers. Any questions? All this is crystal clear?
Oh, yeah.
Yes.
When choosing the Medigap, you mentioned the difference in the cost. I presently have cups. What does it mean, this extra, sorry, I don't have the page in front of me. Here it is. What does it mean to add on a Blue Cross Blue Shield hearing vision rider?
Okay. I don't know if you all heard her question, but on your Medigap sheet, that's the one that has the blue border on the top. Blue Cross sells a hearing and vision rider. You have to buy their Medigap to purchase that rider. It's pretty cheap if you buy their Medigap to add on the rider. It's a hearing and vision rider, but you can't buy it without buying the Medigap. Blue Cross does offer a couple of dental plans, and you don't have to be in their Medigap to buy one of their dental plans. You certainly can do that. Humana, further down the page, the most expensive Medigap in Massachusetts, offers a vision and dental rider, and it's pretty good. The dental isn't bad. It's pretty good. You know, no dental insurance covers 100%. Nothing does that. but this is pretty good. And it's not, the rider itself isn't all that expensive. See the difference in if you bought it with the rider or without the rider, but you have to buy the most expensive Medigap to get the rider, and you have to have the Medigap. Now, one more thing I didn't tell you about Medigaps, and this is so I'm glad you asked that question. Medicare, we're talking now about Medicare's open enrollment for Medicare products. Original Medicare, Medicare Hmo, Medicare PPO, Medicare Part D. That's Medicare. Medigap is not Medicare. This is private insurance that you buy to fill the gaps in your Medicare. These, in Massachusetts, have continuous open enrollment. So someone technically could buy a Humana Medigap and get the dental rider, and then get out of it at some later point and go down to a cheaper plan. Perfectly okay to do that. You can go back and forth. If you happened to be in a core plan and needed surgery, you could go up to a supplement 1 plan so that the hospital deductible and your additional days in the SNF were covered. Perfectly okay to do that. Any change you make takes effect on the 1st of the following month. So if I had core right now, and my doctor said, well, we need to do knee surgery. I'm going to schedule it for October 25th. I said, oh, wait a minute. No, wait, make it November. And I go up to a supplement 1 because then I'll have full coverage. Perfectly okay to do that. Perfectly okay. Because they have continuous open enrollment. You can change within plans. You can change within plans within the same company. You can change from one company to another. Perfectly okay. One more story I want to tell you about that health safety net because it's such a wonderful benefit. Last year, I got a call from a fellow who was on a Tufts, sounds like I'm picking on Tufts, but they happen to have a lot of plans. And he and his wife were in a Tufts plan that was going up to, I think last year it was 180 or something, from 172 up to 180, something like that. They're each paying this. So he called Tufts and he talked to a customer service rep and he said, this is getting to be expensive. Is there anything cheaper? And she said, yes, you can get into a plan that's going to be 151, I think. And he said, okay. And he happened to call my office, us, just to run that by us. And I asked him about his income. When you talk to Shine, we always want to know what your income is. Not because we're nosy, but we are kind of nosy, but we want to find out, are you eligible for anything that's going to help with your costs? So I asked him what his income was. He and his wife had an income that made them eligible for the full health safety net. Okay, so now they signed up for plans, they're saving a little bit of money, that are going to cost them about $300 a month, $151 I think they were and change each. I said to him, you're eligible for this program. You could go down to the 0 premium plan in Tufts. Wouldn't do that. Didn't trust anything that didn't charge a premium. So he and his wife went down to the $35.90, I think it was last year, plan. Each of them went down to $35.90 plan because they were getting on the health safety net. That was going to pay the high hospital hospital copays. That was a big difference. From $300 a month down to under $80 a month for a premium. So that's fantastic. And that's the stuff that keeps us doing this because it's so exciting, isn't it, Norm? When we strike out like that, it's fantastic. So that's always what we're doing. When you talk to us, we're going to ask you about income and assets because we want to see, can we get you into any kind of a program that's going to reduce some of your costs, to help with some of your costs. So that's my last pitch, I guess. Any other questions?
Do we have a test?
Well, you passed. You're still awake.
Not the two out more, but I think the numbers you gave us recently, people who went to see Shine counselors in housing, I think it was estimated that we helped save them was $8 million.
Yes. I don't know if you heard that, but the state Shine office, there are 14 regions. I'm director in one region, and there are 14 other regions. And we're run by the state, the Executive Office of Elder Affairs, the State Shine Office. And the State Shine Office keeps statistics, of course, what program exists without statistics anymore? Keeps data on how much we save people, and there are dollar amounts given if we get you on prescription advantage, if we get you on the health safety, and any of those things. And then every year they tell us how we did. And last year, my program alone, and my program only covers 24 towns, saved over $8 million to people. Well, that's unbelievable. That's really amazing. And I think statewide it was like 79 million. Yeah, amazing. Yeah. Yes.
Less money.
Do you recommend a supplement insurance? I don't have any, but I'm basically in good health. My husband has a good program. He has a top Blue Cross Blue Shield. But I don't pay anything extra to any, I have United Healthcare, and I have to pay $40. It's going to go up to $40 a month that I have to pay besides for the drugs, I guess. But do you always recommend to get extra insurance?
Okay, this is an interesting question, because this gal said that she has United that's going up to $40 a month. So that is a Medicare HMO, or a Medicare PPO. In this area, it's a PPO. Correct?
Right.
Yeah. So let me direct you now. No, I can't find the page, so someone needs to help me. Let me direct you to page 10 of this sheet.
That's your program.
So this gal is in United Health / AARP, but the insurance company is United Health. PPO. And remember that a PPO allows someone to go outside of network without a referral, but usually they pay more. So if this gal, if she sees a doctor, so she has wonderful coverage, she has Medicare, and she has drug coverage as well. If she sees a doctor in network, she pays $25. If she sees a specialist in network, she pays $50. If she goes into an in-network hospital, she pays from day 1 through 3, $495 a day. If she goes out of network, across the board, she pays 40%. So if she's in an out-of-network hospital because she has an emergency somewhere out of network, and she winds up in the hospital, it's 40% of what? You don't know what that cost is. That makes me a little nervous. Now, I think your question was, do you need supplements? You can't get supplements on top of this. You can't buy additional insurance on top of this. A Medigap is not allowed to sell you if you are in a Medicare Advantage plan. So your option is to stay in a Medicare Advantage plan, to change Medicare Advantage plans, or go back to original Medicare. I said that usually PPOs charge more out of network. Blue Cross has a couple of PPOs that they don't distinguish. They don't charge out of network higher amounts, and those are on page thank you. On page 9 is Blue Cross PPO. And they don't, but they're two lower cost PPOs. One is 0 premium, one is $49 a month. They do not charge higher cost out of network. It's interesting, the more expensive PPO they do. They charge 20%, go into an out-of-network hospital. And again, 20% of what? You don't know what that cost is. And that always makes me a little nervous. But no, you can't buy insurance on top of what you have. You can certainly change your insurance, but you can't buy more on top of it.
So is this, we have to, there's no monthly fee for Blue Cross Blue Shield?
That PPO there is. But let's look at it. So the PPO, on the top of the page, is a 0 monthly premium with Blue Cross. They impose the $320 deductible on tier 3 to 5 only. Your plan imposes $255 on tier 3 and 4, which is odd. The copays for drugs in this plan with Blue Cross is $6, $12, $45, $95, 25%. You pay $25 to see a primary, $45 to see a specialist. If you went into the hospital in this plan, in network or out of network, from day 1 through 5, you pay $325 a day. So that's an expensive hospital copay. If you're eligible for the health safety net, we'll pick that up for you.
So I was talking to Norm, and he said to go with the Tufts because there was the with no premium in that.
Well, TUS has a plan with no premium too. I'm sure Norman pointed that out to you as an option, but we certainly don't tell people what to do. We give you your choices, and you make them, because we can't make them for you. Any other comments or questions, or has this been helpful? Does it make a little bit more sense than it did when you walked in the room? I certainly hope so.